For the fecal transplant discussion board, we learned about how the fecal transplant occurred by taking the healthy stool and mix it with water to dilute it a little, and you put it into a sick person via an enema. The first recorded use of this practice was in 1958, and it saved patients from death within 48 hours, and it was used in the United States. One of the main diseases that causes them to do the fecal transplant is C. diff, which is very common in the nursing field, as we all know, and it damages people's colons. 500,000 people per year are diagnosed with C. diff, and 5% of those people die. And C. diff is caused by antibiotics, but it's also treated by antibiotics. And every time you contract C. diff, your survival rate decreases. Like the presenter said in his TED Talk, when he prescribes antibiotics to patients, he also prescribes a probiotic to help decrease the chance of contracting the C. diff. This transplant is not approved by the FDA, and they actually consider stool to be a drug because it helps people. The fecal transplant actually has the same benefit to IV treatments. Some conditions that cause somebody to need a fecal transplant are autoimmune inflammatory bowel diseases, Crohn's disease, ulcerative colitis, irritable bowel syndrome, and multiple sclerosis. I thought it was kind of interesting how the presenter said what happens in the gut can affect the brain, and how he also mentioned that in the past, poop used to make us sick and antibiotics would save us, but now the antibiotics are making us sick, so the fecal transplant helps save lives. The fecal transplant can actually be taken through an enema or a pill capsule. When they do the pill capsule, they reduce the bacteria and all that from the stool down to 10% and encapsulate that. And originally it was not used on children, but when the doctor said, well, we could try it because if I was a parent and this was my child, I would use it on them. So once that child was medically clear, they used it, and it eventually led to this child that was 2 years old at this point in time that had a history of loose and bloody stools all the time. It led him to have more formed stools and less blood, and within a year, he was living a healthier life and was having less issues with his medical disease.